Content in this video should not be construed as medical advice. It is for information purposes only. Please consult your physician with any health concerns or questions.
I'm Leland Gebhart with the Women's Clinic. Today's topic is discussion of Essure. Essure is a permanent form of birth control that has been trusted by thousands of doctors and women since 2002. It has a 99.7% efficacy rate over 5-year clinical data trials and involves insertion of some soft micro inserts into the fallopian tubes through the cervix, making this a minimally invasive procedure and therefore a safe procedure which can commonly be performed in the office setting. Some common side effects that may be observed during the procedure would be some nausea, some mild cramping, similar to that of a menstrual cycle. Some women may experience some lightheadedness, but generally it's a very well tolerated procedure and no different than what a minor office procedure would entail. There's no significant anesthetic risk, no significant burning or general anesthesia that would be involved. There are no hormones involved in the micro inserts with Essure, therefore it should not affect a woman's menstrual cycle or ovulation. Generally, that would be between the physician and the patient, but as a general rule, most physicians will lean a permanent form of contraception to an older age group or those that have completed their families. Essure is not reversible, it is a permanent form of contraception. They're an inert material. It's always important to inform your facility or your physician that you've had the inserts, for they may see them on x-rays, but as a general rule they're safe to have, such as an MRI is a common question I receive. They're safe. Depending on your insurance plan, that would be something that would need to be evaluated, but Essure is covered by most insurance plans as a part of a contraception. Well, I believe Essure has a proven safe record. I believe also, due to the option of it being a minimally invasive procedure, the recovery time is less, and there's not many forms of birth control that can offer a 99.7% efficacy rate, but only if a woman has completed their family and are sure that they don't want to have any future children, because the most important thing to understand with Essure is although it's a minimally invasive, safe procedure, it is permanent. Well, Essure is an incisionless procedure. Therefore, there's not much recovery time or pain with Essure. I believe that for a woman with an active family or someone who has completed their childbearing and needs to be on the go, that it offers them a minimal recovery time and a very viable option to the other procedures that are out there, such as tubal ligation that involves general anesthesia, potential for burning and pain and incisions. I feel like it's by far the best method to offer them as far as recovery time. The Essure confirmation is a test we perform 3 months after the procedure to assure that the natural barrier that we want to occur over 3 months after the application of the inserts has occurred to occlude the fallopian tubes. It involves a simple dye test and an x-ray to assure that occlusion has occurred. Thereby, women will need to be on a reliable form of contraception after the inserts are placed until this test is performed, and it's easily performed in an outpatient setting as well.
If you would like to discuss this or any concerns, please contact your physician at the Women's Clinic at 601-354-0869.